name is Dr. Brian Levine, and I'm one of the physicians with CCRM New York, based in Manhattan. One of the most common reasons that we see a patient is to help them better understand their ovarian reserve, or their fertility. Frequently, patients come into our practice asking us, what does my fertility look like? What are my chances of getting pregnant? What tests can I do to better understand my reproductive potential? Well, one of the most common things that's done at your OBGYN office or in our office is a simple blood test for a hormone called AMH, or anti-Mullerian hormone. This hormone is made from some of the smallest cells within the ovary called the granulosa cells. And these cells secrete this hormone, and it helps us better understand how many eggs someone actually has. With that said, we all know that patients are more than just a simple number. You're more than just a score from an AMH. And sometimes when people have their AMH checked, they come into our office completely confused and not understanding what the results mean. We know that there's a range for normal patients, which could be anywhere from 1 to 3, but it's a relatively difficult scale to assign to someone because your fertility is something that's dynamic. It's based on multiple numbers, multiple assessments, different testing modalities, and patients are more than just an AMH score. The other most common test that we use to help someone understand their reproductive potential or their ovarian reserve is an ultrasound. An ultrasound, when done on the first few days of someone's cycle, can help us understand how does their egg count look. What we mean by that is that doing an ultrasound in the first few days of the cycle, before anyone's recruited an egg, helps us understand how many follicles are sitting in the resting pool. How many follicles could we access, for example, if we were to give you really high doses of medication, doing something for like egg freezing or in vitro fertilization? Or maybe it helps us better understand that you're someone who could respond quite robustly to medication and you need very little medication. AMH is a blood test, ultrasounds are another test. Putting the two together helps us understand someone's ovarian reserve. Frequently, patients will come in here and say, I have results that just don't make sense. I have an AMH score that might be high or low. I have an ultrasound that might be high or low. How do I know what's actually going on with my body? Well, another way to test someone's ovarian reserve is to better understand the signals from their brain down to their ovary and the signals from their ovary back to their brain. Frequently, people will do what's called day 2 or day 3 testing. If you check a woman's hormones in the first few days of their cycle, you can better understand how well the brain is talking to the ovary by looking at a hormone called FSH, or follicle stimulating hormone. Think of this as the signal to make an egg, make an egg, make an egg. If the FSH level is very low, that says that the brain does not have to release much hormone to signal to the body to make this egg. If the FSH is very high, well then you know that the ovary is struggling to make an egg because it's not responding back to the brain and the brain keeps sending down this signal. The signal from the ovary back to the brain is estrogen, which is the number 1 hormone made by the ovaries. So we know that as you go through your cycle, as an egg is developing, increasing amounts of estrogen are made. So by checking someone's hormones of day 2 or 3 and looking at their FSH level and their estrogen level, we can get a better understanding of someone's reproductive system and how well the system is aligned. With that said, frequently people don't come in here on just day 2 or 3 of their cycle. People frequently go to their OBGYN office on birth control, for example, where you can't test your day 2, day 3 labs because everything is low. So we always tell people we can do an ultrasound and we can do AMH. In fact, the American Society for Reproductive Medicine recently said that the ability of AMH and an antral follicle count to predict someone's egg yield, as well as to understand someone who might respond well or not well to medicine, has been well demonstrated and validated. So, what I would say is you're more than just a number. But next time you want to understand your reproductive potential and understand your ovarian reserve, get an AMH and an ultrasound, and a doctor from CCRM will be happy to help you interpret those results and explain what it means for your future treatment plan.